Right. So I think we'll just proceed with the panelists introducing themselves. We'll start from the very far end, coming this way. Thank you.
Hello, everyone. My name is Mukami Munyoki. I am the program manager at Mental 360. My boss and our executive founder was to be on this panel today, but I will be here in place to represent the organization. I am 5'4". I wear glasses. I have my beautiful big hair on, and I have a red blazer on. I am also a mental health advocate. I find great pleasure in supporting individuals to live their best lives, and it is a pleasure to be here today. Our tagline at Mental 360 is Conversations Save Lives. So I'm really honored to be here engaging in this conversation today. Thank you.
Thank you, Mukami.
Thank you. Good afternoon. My name is Sara Theuri. I am a counselor at the Kenya Institute of Special Education, where I work with children and parents of children with disabilities. And I'm happy to be here today, even to be part of this conversation. I am short. I have cerebral palsy, and I'm in a navy blue trouser and a cream top. And I'm happy to be with all of you. Thank you.
Thank you, Sarah.
Good afternoon. My name is Africa Kanyi. I'm an occupational therapist, a consultant in mental health. I practice in various hospitals in Nairobi, private sector. I've also experienced disability matters, that is working with children, both children and parents of people living with disabilities. I'm happy to be here. Thank you.
Thank you, Africa. So, Mukami, I'll start with you, right? Over the years, we've seen technology transform mental health services and mental health resources. We've seen it bridge the gap between demand and supply, and people are able to access these services digitally now, right? So how can technology be leveraged to improve mental health services and support for persons with disabilities, especially people living across diverse regions in Africa? Yeah.
Yes, thank you so much. So we are seeing a lot of increase in demand for mental health support and mental health services, yet the access to these services is still very limited. You realize that in Kenya, for example, only about 70% of Kenyans do not have access to mental health resources and support. And so leveraging on technology is very, very crucial because it allows us to provide this support in a timely manner and in a very efficient manner. So some of the various ways that we can leverage on technology to be able to bridge this gap between demand and access is number one, teletherapy. And this is something that grew a lot of attention and a lot of usage during COVID, because what was previously the traditional way of doing therapy was physical sessions. And now with COVID, there was no way to meet physically. People had to be isolated and keep indoors. And so from this, a lot of the transformation that we've seen in counseling services happened during this period. And so teletherapy allows us to be able to give and to offer these services through digital platforms in a very timely manner at the comfort and convenience of clients. And not only just having the counseling sessions being done digitally, but we are also able to do mental health consultations as well. And so this cuts a lot of factors and barriers that were existing before in terms of accessing this service. Another way that we can leverage on technology in mental health is through providing mental health trainings and conducting mental health webinars using digital platforms again. Again, COVID really taught us that you don't need to wait to have a physical session or a physical engagement with various people and stakeholders to ensure that this conversation continues. Now we are able to organize for mental health webinars and talk about pertinent issues that are affecting a lot of individuals in a very convenient manner, and you can have conversations with literally anywhere in the globe. Yeah, so it has brought an opportunity for us to be able to have discussions and get trainings and be capacity built when it comes to mental health, regardless of where you are. Yes.
Thank you, Mukame. Sara, I'll come to you. In terms of barriers and challenges in persons with disabilities accessing digital mental health services, we've seen they're there, right? In my experience, I can tell you in the mental health practitioner world, there are some practitioners who feel like digital mental health services are not effective, right? There are others who just struggle with literacy of digital technology and these mobile applications and technology in general. So for you, what are the key challenges in ensuring that these digital mental health solutions are inclusive and accessible for persons with disabilities?
Thank you. There are many challenges of accessibility of persons with disability in the digital platform. One of them being that the devices may be very expensive, and so most of persons with disabilities, especially in both in the urban and in the remote areas, are not able to afford them. So I think there should be affordable, a solution for that. There should be affordable, specific devices for persons with special needs, whereby people who are even in the most remote areas can access, because like now we were having floods in Kenya. People with disabilities would have been would be having an appointment to meet a therapist, but because to their accessibility in the road and so forth, they cannot go meet their appointments. But if they have devices accessible to them, the sessions would go on, and so their mental health will be catered for. And the other challenge is friendlessness in the current online. Sometimes people with disabilities may not have devices that are friendly to them. Maybe a person is visually impaired, and there is a prompt to do this when you are even making an appointment. Unless we have the devices with apps like talking back to the client will not be able to follow the prompts, or rather, he would have to use a second party to help in the same, thus affecting the confidentiality of the client. And we know that as mental health practitioner, we practice confidentiality. So such a person may shy off of going on with the appointment because the helper may wonder what kind of things are you going on. So maybe user-friendly devices in which they guide the person on how to go on with the prompts are very necessary. The other thing is about the accessibility to digital platforms like Google Meet and Zoom and other things. Some of these apps may not be friendly to people who are maybe with hearing impaired, because they don't have interpreters. So such things should come with captions in which the person can read what is being said to the other person. And then there is a lot of illiteracy. So most of the people with disability may not have digital training. So having such platforms may affect the accessibility and therefore the mental health. And you see, when, as we know, mental health is the ability to cope. So if you can't access these digital platforms, it brings about more mental illness to the person, which affects the productivity of the person. Maybe as I finish, I would say policies should come up to bring about artificial intelligence gadgets in which the persons with disability will be assisted to know what is happening, like especially the people with visual impairment. They can actually read the applications can actually read the messages for them, and therefore you don't need a second and third party to help you on the SIM. I think that is all for now.
Thank you.
Yeah, thank you.
Thank you, Sara. You've mentioned these devices are not as affordable, right? And not everyone has access to them, and even usability and data and privacy concerns are another barrier as well. Mukami, I'll come back to you, right? They say there's strength in numbers, right? So how can mental health professionals, tech developers, and other stakeholders, the organizations of persons with disabilities, how can these partnerships be strengthened for digital mental health services to be more inclusive?
Yes, thank you so much. I think mental health is very, very complex. And so as different institutions that are serving populations or are trying to tackle and address the mental health issue, we cannot continue to work in isolation or in silos. We really need to have coordinated interventions and create solutions that are that target the needs of the populations that we try to serve and that are very inclusive. And so one of the fundamental ways that we can ensure this coordination and collaboration is through co-creation, creating spaces and sessions for co-creation. So we need to ensure that the people or the target audience for these interventions that we need and that we are creating need to be central. So there's a saying that a lot of youth like to say that there's nothing for us without us. You know, so if we are creating interventions for people with disabilities, they need to be central to these interventions. A lot of times you realize that some of the very well thought out and designed solutions, they fail because they're not able to meet the needs of the people that they are created to serve. So we need to ensure that we create spaces where we bring together different stakeholders, where we are able to talk and collaborate and identify what are the pain points that we need to address. And then from those sessions, now we can come up with the interventions. In this way, the interventions are very targeted, they're very inclusive, and the people whom they are targeting feel included, and they feel like they've been dignified in that process. Yes.
Thank you, thank you. What do you think, Africa? Is there anything more to add in terms of how these partnerships can be strengthened just to make these digital mental health services more inclusive.
I think I'll just emphasize on what she said, on you cannot make decisions without involving the stakeholders. We can use interventions like conducting like a baseline survey, first of all, before making policies or making decisions for the people involved. Yeah, just to emphasize.
Thank you. And I think more forums like this, right? So that where we can have the conversation, because by having the conversation is how we spread awareness, right? A lot of the time, these things don't happen because there's no awareness, right? So by having more forums like this where we have a shared interest, and I think even having concepts where people are assigned roles, right? People from different industries are assigned roles where you can work collaboratively to achieve the goal. Now, Africa, I'll throw this at you. What role can data privacy and protection regulations play in safeguarding the rights and dignity of persons with disabilities who access these mental health services? We know confidentiality is a very big thing when it comes to health services, right? And, you know, people want to understand how their data is being stored, what their data is being used for, and sometimes these user terms and conditions are just too long for someone to go through, right? So what can be done in that front where data protection is being prioritized when it comes to the rights of people with disabilities? Yeah.
Okay. So I think that mass education would be a tool that we can adapt or use in the sense of before we engage the audience on how to use these assistive devices, or for example, I as a therapist, before we have a session, I think I have a responsibility to inform or educate the user that confidentiality is key. Apart from that, this is how I will store your data and it is protected. Yes.
Thank you. Sara, you talked about, touched on data protection. You mentioned that some of these apps, the helper might see what the person is talking about. Any recommendations on how this data can be protected?
One of the things that we need to do is to train the persons with disability so that they are able to independently be able to feed their data into the apps without any helper, because that is the way data is leaked to other places. Another way that we can protect the data is that when this data should be accessible to only the practitioner who is working with this person, so that that kind of information is not leaked to other people. Yes.
Okay. Thank you. And now for our last question. How can governments and policymakers prioritize mental health inclusion and prioritize also broader disability rights when it comes to access to these resources? Africa, what do you think?
Well, thank you for the question. I think number one, we need both the government and the policy makers need to invest heavily in research and data. Before making any decisions, as I said before, they need to work with the people in the ground. And then can we also integrate mental health into disability policies? Yeah. We can also ensure accessibility of mental health services to people living with disability. This can be done in various ways. Number one, we can have continuous training of health professions on how to relate. Let me use the word relate, or how to interact with persons with disability, because no disability is the same. As my colleague has said, at times, for example, if a client who has a hearing impairment came for me for a session, I would not be in a position to help them. I would need an interpreter, and that can further affect the confidentiality or the prognosis of the treatment. So I think we need to train more healthcare workers. We also need more access to therapy services, medication as well. And then we also need, recently the government has launched or introduced healthcare workers in the communities. So can these healthcare workers also be trained in mental health to help persons living with disabilities? The other thing I would say, can the government also help combat and address determinants of mental health? Because mental health issues arise from different things. It could be poverty, it could be social injustices. So whatever it is, can we have people being empowered more? Yeah. Maybe the last thing I would say is, then maybe, yeah, I think that's all.
Okay.
Thank you.
Thank you for that, Africa. So, you've mentioned, I think, and all this comes with also funding, right? With funding, you're able to do more capacity building, you're able to build more infrastructures, train more professionals, and that will contribute to the demand and supply gap narrowing significantly. Anyone else has anything to add on that point? Mukami, maybe?
I think you've mentioned what was in my mind, budgetary allocation.
Okay.
Yeah.
Okay. So it's my understanding that we're short on time. So unfortunately, we won't have time for the Q&A. But thank you for attending this session. Thank you, panelists, for your insights and views. And thank you to everyone watching. Asanteni sana and have a good afternoon.